Thank you for joining us today for our survivorship special topic. My name is Julie Lanford, and I'm the Wellness Director at Cancer Services. We are a cancer support nonprofit in Winston-Salem, North Carolina, and each month we offer a special topic video around survivorship with experts in a variety of areas relating to cancer and cancer caregiving. So these videos are posted on our Cancer Services website and our YouTube channel, and the audio is also available on our podcast, The Triad Cancer Connection. All survivors and caregivers are invited to join us for a discussion about this particular topic, and our discussion group will meet virtually on the fourth Tuesday at 7 p.m. So in April, that would be Tuesday, April 25th at 7 p.m. on Zoom. We do ask that you register so that we know who is planning to attend. And you can find our registration page at cancerservicesonline.org/register. Make sure you're on the April registration page for this particular topic. And our topic today is nutrition during and after treatment. And we have two expert speakers today, Lora White and Amber Thomas, who are both registered dietitians and board certified specialists in oncology nutrition. And it's going to be a really great discussion. So we decided to do this topic because it is pretty common for people to have nutrition, either challenges or just questions about how to nourish themselves during and after treatment. So first, I want to introduce Lora White, who will kick off our discussion today. She is an oncology dietitian with Novant Health Cancer Institute here in Winston-Salem. And Lora, how many years of experience do you have now? 5, 6?
Almost 8.
Oh my gosh. Okay.
I know.
So we are lucky in our community that we have 2 cancer centers, and both cancer centers have dedicated outpatient oncology dietitians. So Lora is one that works in an outpatient cancer center to support patients through treatment, kind of figuring out, what to do. So Lora, what do you think is one or kind of the most important thing people need to keep in mind when it comes to nutrition during treatment?
As a oncology dietitian in a cancer center, my number one is trying to get people to maintain their weight and not lose weight during treatment. And so nutrition is really important. You can't tolerate your treatment and make it through without proper nutrition, without giving your body the energy it needs.
Right. And that's kind of, some people, it feels like some people are just fine, but then other people, it's a real big challenge to just eat. I know appetite is a pretty common issue. People they just don't feel like eating. And so what suggestions do you have? What have you noticed or works for your patients when it comes to nourishing yourself, even if you don't feel like eating?
It's kind of having to switch that mindset of eating because you want to, and now you have to eat because you have to. We try to get patients to, set out snacks and meals that they prep ahead of time, maybe set a timer on their phone, something to remind them that they have to eat, pair it with something that they normally do, a TV show that they watch every day, like the news, just something so that, they're not waiting for their body to tell them that they're ready to eat. They're doing it because it's time.
It's time to eat, and then maximizing
Yes.
maybe, which feels different from, what it's like for a lot of people, which is, oh, I'll just respond when my body says to. So it's hard. How about diarrhea? Another common issue. I was at an event this weekend actually with some colon cancer survivors, and there was one person there in treatment who was, for her, like the big issue was she was just having so much diarrhea, and that was causing, she didn't want to eat because it was going to cause this problem. And what are the things people can do for that? That feels like it keeps you at home kind of stuck situation.
Yeah, that's definitely a difficult side effect of a lot of treatments. It really depends on what's causing the diarrhea. What we would recommend, but in general, we want you to follow a low fiber diet. We don't want you to eat a lot of fiber that would exacerbate the diarrhea. Also staying hydrated, drinking plenty of water. You don't necessarily need an electrolyte beverage unless you're having a lot of loose stools, but you need to stay hydrated. And then, eating things that you tolerate. It may be, not what you would consider the healthiest if you're trying to eat a lot of fruits and vegetables because of the fiber, but you could still eat a lot of things that, are still rich in protein and calories to give your body what you need. And then depending on how bad the diarrhea is, your doctor will prescribe medication, but there's also some products like Metamucil, which is a soluble fiber supplement that can help. There's also like a specific fiber supplement that's been designed for patients going through treatment called Banatrol that some patients find useful. And then for extreme cases, there's also a product called Enterade that's, it's really expensive is the downside of it. But for patients, especially like transplant patients that have diarrhea afterwards, it's been pretty successful for them. But it really just depends, like I said, what's causing your diarrhea and what's best for you.
Yeah, so it's like, it sounded to me almost like 3 tiers or 4 tiers of managing, which I feel like it's really important that, patients stay in contact with their medical team, because otherwise the medical team's not going to know what's working or not working.
And also, speaking for yourself, don't just assume that you're going through treatment and this is a side effect that you have to deal with. Let your doctor know, let your dietitian know, anything that we can do to help. It's not something that you just have to suffer through. There's some things out there that can help you.
And people always think, dietitians are I feel like that the patients or the caregivers, they have in mind what they think the dietitian is going to say. And it's probably not what's in their mind. And just like this concept of managing diarrhea and telling people to eat a low fiber diet is probably kind of opposite of what people might think the dietitian is going to tell them. So, it's best if you actually have the conversation rather than assuming that what the care provider is going to say.
Definitely.
Because those products are they can be helpful for people, but you have to kind of use them the right way.
Right. Mm-hmm.
Right. Yeah. So it's best to be kind of paired up with somebody who's helping you through that rather than just figuring it out on your own. Okay. So how do people know if they're meeting their nutrition needs? Like, how do they know when to ask for a meeting with a dietitian versus, they're getting by just fine? Like, what are some signs that they might need to reach out for extra help?
Number one, weight. If you're losing any weight at all, that's something that shows that you need a dietitian. If you're losing weight, your body's not getting the calories and the protein that it needs. Also, extreme fatigue, dehydration, signs that, maybe you're getting enough calories, but you're not getting enough protein or you're not getting enough fluids. And then your side effects. If you're having anything that's making eating difficult, whether it's taste alterations or diarrhea, ask your doctor for a referral to a dietitian.
Awesome. And they are weighed. I mean, they should notice if their weight is changing, right? I mean, mm-hmm. Don't just let your medical team track your weight for you. You should also know what your numbers are.
Yeah, if you're tightening that belt, if your pants aren't fitting anymore, if you're buying new clothes, all of those are signs that you're losing weight.
Excellent. So I feel like that's pretty easy. Not that it's easy to manage, but like those are kind of simple things that you can do. Thank you, Lora. We'll have you come back on in a second. But my next guest that I'm going to turn to at this point is Amber Thomas. And Amber is also an oncology dietitian. She's actually located in Colorado, which remind me what city?
Denver.
Okay, perfect. Yep. Everybody knows where that is. And Amber has worked as a outpatient or clinical dietitian in the past. She now runs her own business and teaches classes and has a website. Remind me the website.
It is www.cancernutritionsolutions.com.
Perfect. And I have collaborated, in case you don't know, viewers, I am also an oncology dietitian. And so Amber and I have collaborated on things in the past, so it's really fun. Thanks for coming back again.
Absolutely.
So the unique thing I think also about Amber is that she does do a lot of post-treatment nutrition counseling with cancer survivors and is trained in the intuitive eating way of approaching a healthy nutrition and healthy body. So after treatment, like we talked with Lora some about those in-treatment issues, which are very acute and like, well, let's deal with it. Let's get you through this treatment. And then when people graduate or whatever you want to say, they end active treatment and they're looking at getting back to maybe more normal eating. Maybe they had to do all these alterations to get through treatment. Now they're like, okay, I need to start eating more fiber. I want to focus a little bit more on a healthy diet.
Yeah.
How do you suggest they step into that?
That's a great question. And the first thing I'd really encourage people to do is have some patience around the transition from on treatment, so active treatment, to survivorship where you're not receiving active treatment. Because depending on what type of modality of treatment you've had, surgery, radiation, chemo, all of it, your healing process may take longer than you want it to. Absolutely, it's going to take longer than you want it to, but it's going to take longer than you think. So it could be weeks to months before your body starts to feel a little bit more like you again. And have some grace for yourself during that time period so that you are able to support your body in the best way possible and transition into something that's more of kind of like a lifelong sort of eating pattern. So that may not look like, I'm done with radiation. Next week, I'm going to be able to eat all the things I'd really love to eat, or I really feel like I need to focus on, certain kind of eating. So lots of produce and things. That may not be what your body can tolerate. And to really respect and honor that your body has needs, and it needs that kind of support for you to get enough to eat, to get the variety that you can tolerate. And then that's okay. It's okay to not be able to do the full variety of foods you like to. Hopefully, and eventually, depending on how your body has changed, you should be able to get more and more variety at a certain point. But really just take it easy on yourself during those transition time periods so that you can enjoy and eat those foods later.
That's a really great reminder. It makes me think about, like, we didn't talk with Lora about head and neck cancer patients who might be on a tube feeding, or if you have mouth sores or things, the diarrhea for sure. Like, even when your treatment stops, it just takes time for your cells to heal and for your body to get back, and you're not going to be able to jump right back into as much as you want to, and I think, we can compare that to how physically active you are. It takes that time, and your nutrition plan needs that same, like, kind of time to transition and not rush it.
Yes, exactly. Paying attention and being okay with where your body's at that time period.
So when it comes to survivorship nutrition, what do you think are some of the most important sort of aspects or things that people need to know about survivorship nutrition?
Yeah, so I think it goes in two parts. So again, understanding your own particular body and what your body can tolerate. If you get to a point where you're able to eat all foods again and things taste okay and your appetite's returning, and that's great. Like, there are more options available. If there are some anatomical reasons where you can't eat lots of different foods or choose certain things, you can still work within those parameters to hone kind of a survivorship eating pattern. And I like to call it eating pattern versus a diet, because the pattern over time matters much more than what you eat for today's lunch, what you eat today and tomorrow for the week. Like, the pattern of how you eat is a much better indicator of just your overall health promoting food intake. So what I like to encourage people to do, though, is to take all the research that we have out there, and we have a decent amount of food and nutrition research related to cancer, but it's all kind of correlation-based research. So it's a lot of observation, and we think that eating more produce can be really beneficial. And that sounds great. And I do like to encourage produce within the realm of what your body can tolerate, but knowing that you don't have to go fully plant-based, that you don't have to go fully onto the other spectrum, that just increasing what you would normally eat can be really beneficial. And to keep in mind that because it is correlation-based, we don't have a cause and effect relationship. So sometimes I can take a little bit of the pressure off of eating in a very, very tight way and just like, okay, what sounds good? How could I maybe increase my fruit and vegetable intake, my whole grain intake? Can my body tolerate that? And then finding things that work for you and for how you really enjoy your food long term.
Awesome. Yeah, I like that flexibility and kind of just paying attention to how it makes you feel or what tastes good, or you don't have to eat certain foods. It's like
That's
we
right.
can
Don't suffer through.
That's what I told someone a group the other day. If your food's not delicious to you and it's not enjoyable, something's not right. Let's tweak that.
Let's change that. Exactly.
Yeah. So body image and body weight are kind of big concerns for many people.
That's right.
I know that we've connected about this in the past, that a lot of the correlation research talks about like, oh, if people are larger body, then is there a risk? And it's just, I think it can be really hard for people. And then they tend to key in on body weight because they want to control, some piece of their outcome. But then their body has also gone through a lot. They might have had body parts removed that visibly are not there anymore, or internal body parts, and they physically feel differently. And it is just hard because body image is so tied up with weight and nutrition and exercise. Like, from your standpoint, how do you suggest survivors even build their framework around healthy weight? Because we talk about that, we say healthy weight, but then like,
what is that? Right. The big question is, what is that healthy weight, right? Yeah. And, as Laura mentioned previously, during treatment, we really want to maintain weight. And when people come into treatment, sometimes there's this almost a silver lining that, hey, maybe this treatment's going to actually allow me to lose the weight that I've been trying to lose for decades. And I really strongly encourage people to listen to the message that maintaining weight during treatment will be your best benefit to getting all the treatment and tolerating it as well as possible. So that, it's great to see those numbers move, but then it's also going to hurt you on the end, where you can't get all the treatment, that you may be hospitalized because you're losing too much weight, you're dehydrated, your tolerance for treatment can really change with a lot of weight loss. So in the survivorship space, this is really hard. This is probably the number one thing I talk about with survivors who are in larger bodies, that like, my doctor's telling me I need to lose a certain amount of weight. Everyone's saying that this is a thing that, causes. We don't have cause relationship, by the way. What we have is a lot of correlation relationship that may look at, body size and cancer risk and maybe advanced cancer time of diagnosis. But I want to throw out one of the confounders that I really think is important to look at, which is weight stigma in medical care. And just in general population, but certainly in medical care. We see a lot of healthcare practitioners dismissing people in larger bodies, saying, that thing will go away if you just lose weight, which is not necessarily the case and can be delaying diagnosis. A lot of people don't want to go and see their doctor, just knowing that, okay, they're just going to tell me to lose weight. They're not going to actually help me. So I'd really like to, put that out there, as that can be a big factor in this. And then, the calories in, calorie out measurement is something that I feel like we think is fully factual. But I want to just throw out there that there could be another theory about weight and energy balance that's called set point theory, which kind of means, if you look at your family dynamics and say, okay, yep, I've got my mother's body, my sister has my father's body, like we have those kind of genetic programming, and our body is kind of designed to be within a certain weight range during our adulthood, that if we're trying to force it out of those ranges, things are going to kick in to try to keep you at that weight. So if we look at it as something like our body's internal thermostat is trying to make sure that, hey, you're supposed to be within this range and you're trying to change that. I'm really going to help you here. And if we're constantly trying to change that, our bodies are going to constantly remind us that we need to eat. We're going to start, super food preoccupation, always thinking about food, like the willpower thing isn't really a thing. It's your body's like, please feed me. We're not being fed enough here. And so with that set in mind, and maybe we don't have as much control over our body size as we think we do, could we potentially just look at health behaviors? Can we focus on things that can help us feel better, that can help, our GI system stay regular? So again, that could look like, can I increase certain things in my diet? And I love to increase things versus looking at taking things out. By and large, we increase things, we probably are going to remove things, replace things just by the nature of the way it works. But really focusing on what can I increase in my diet to help me feel better, to help my body feel as good as possible, to give me a lot of energy, to help me feel, as supportive as possible. If we can look at these behaviors, those are the things we can fully change. Our weight is an outcome. Our weight may not change whatsoever depending on how we eat and what we eat. So I really want to focus on those things that we can focus on.
Yeah, I kind of come to the same place with my clients because you know what? They might be doing hormone therapy. They might have been forced into menopause. They might have, some of their organs removed that are important for like hormonal balance.
That's right.
Or they're taking for a lot of men who are prostate cancer survivors who are taking treatments that are just causing changes in their body that I think are out of your control. And therefore, your body weight is sometimes something that you cannot control. However, your health behaviors are things that you can pay attention to, that you can tweak, that you can try to see what works better or doesn't work. Right. And so, for me anyway, when I'm working with clients, it's the same thing. It's like, hey, we can watch the scale because we don't want people to lose weight unintentionally in unhealthy ways. And the scale can sometimes tell us, if there's something else that needs to be looked at, but we don't set our health goals based on a certain number on the scale. Like that's just a piece of information that's helpful, but our health goals are more around behaviors and how those result in like your energy level or, your
blood work. Like we can look at other measures besides what the scale looks like for sure.
Yeah. So when it comes to nutrition intake, are there like any supplements, or a lot of people ask me this question and, like, what do you say? Are there supplements that you think survivors often need, or are there certain nutrients you think they should monitor more closely than maybe the general public?
By and large, there are no supplements that I recommend across the board. I'd say if I were to recommend one, it's get your vitamin D level checked and likely you're going to need to supplement that one. Other than that, even for a basic multivitamin, it's okay, let's look at your food pattern. Do you feel like you're eating enough? How's your appetite? Do you feel like you're eating according to that? Like sometimes there's a weight aspect, and sometimes, like a lot of my clients who are in survivorship, we don't do anything with weight. Like that's not a measurement that we look at. We look at other factors. What colors of foods are you eating? What kind of variety are you getting? And then maybe there needs to be a multivitamin added while we work on variety. But by and large, it's that vitamin D because it's just really hard to grab from food and process depending on, where you're at in the hemisphere. That one is by and large one that I kind of recommend across the board. But as far as herbal and dietary supplements, there aren't any that I recommend, but I definitely I use the Natural Medicines database to evaluate any supplements that my clients are like, should I be taking this? Well, let's look to see if there's harm. And if there's not harm, or we don't see that there's harm, is there any indication that's helpful? That's usually pretty gray area. And then it's up to the client. Like, I don't see harm. There's no contraindications with your medication. Here's the information. It's up to you.
Yes. Okay. So I didn't get to ask Lora that question, but actually I think it'd be interesting. So Lora, I'm going to have you come back on. And before I ask our final question, I'm curious, Lora, like during treatment, are there supplements you recommend a multivitamin? Kind of what's your take, especially during treatment?
It definitely varies person to person. In general, we recommend that patients avoid herbal supplements and different vitamin and mineral supplements, especially things that are antioxidants, because that might interfere with their treatment. And if they want to take anything, it's definitely something that they need to discuss with their doctor. And then on the other side of that, labs are taken, very often during treatment. So, if your iron is low or if your calcium is low, your doctor will let you know, and then they'll recommend that you supplement that. But we don't recommend anyone just blanketly take a supplement. It's really based off how they're doing during treatment.
Awesome. Okay, so this is a ton of really great information, and I so appreciate everything you've shared. And as we kind of close out, I do want to ask each of you to share one piece of advice. This is what I ask at the end of every special topic video. What kind of one piece of advice would you send people away with? So Lora, I'll start with you.
I would say, just definitely take the time to take care of yourself during treatment. Make sure you take the time to rest, make sure you take the time to, de-stress, and make sure you take the time to nourish yourself. The stronger you are during treatment, the better you're going to tolerate. And I know it was brought up earlier, you just really don't want any treatment interruptions. The treatment is what is treating your cancer, and everything that you can do to make sure you're as strong and healthy as possible during that, so that that treatment can treat your cancer. That's what we want.
Awesome. All right, Amber, what's your one thing?
Man, there's so many things, but really the first one is to pause and take a step back, and ideally find someone, maybe an oncology dietitian, someone who can kind of be in your corner to vet a lot of the information that's coming your way. I know in my experience, and I've been an oncology dietitian for like 20 years now, like in my experience, it's find someone who can say yes or no to your friends and family about things that they're bringing to you. So you don't have to kind of people please around some of the, like, you should be taking this, or you should be doing this kind of diet, or you shouldn't be eating sugar and all this kind of stuff. Like, bring it back to your healthcare team, and then they can say, oh, well, you can tell this person your dietitian said this, that, and the other, because there's just so much extra stress. You don't need that piece too. And I know a lot of people are super helpful, and we really want to try to support you the best way they know how, but a lot of that information is not helpful and it's not supportive.
Yes, let us help you lower your anxiety, and you can also push off, blame us, right?
Let us handle it.
Someone tells you have to eat kale. No, your oncology dietitian said, no, you can eat something else. Somebody says you're not allowed to eat sugar. No, your oncology dietitian says you can fit sugar.
It's okay. And here's some research on that. Exactly. Yep.
So resources, you can always go to cancerdietitian.com, and I am happy to help. And then Amber, remind us your website.
It is www.cancernutritionsolutions.com.
There you go. You got two oncology dietitians, and then ideally you also have like a Lora at your treatment center that you can ask questions of and get help from. So as we close out today, I want to say thank you to Lora and Amber, my amazing oncology nutrition colleagues, and also remind you that we will have a discussion group about this particular topic. It's on Tuesday, April 25th at 7 p.m. virtually, and you can register for that at cancerservicesonline.org/register, and we'll have this video available. You can share it with others if you would like. And we thank you for joining us today and each month. If you have suggestions on topics, please reach out to me and let me know what you think. Stay updated on our survivor programs at Cancer Services by checking our website and getting on our email list and social media channels. We would love to see you online or in person sometime in the near future. Thank you so much. Have a great day, and we'll see you next time.